I think I'm going to enjoy sharing this story with you guys today. So, 20 years ago, when I began my journey into the world of audiology, I would never have believed you if you told me that one day I'd be sat on the Eurostar, travelling at 180 miles an hour from London to Brussels, heading to meet members of the European Parliament, cochlear implant and hearing aid users, plus some of the top key opinion leaders and decision makers in the hearing aid world, all in one room together to discuss the impact of hearing loss on both individuals, on society, and in fact on the world's economy. And this was opening up the conversation around acquired hearing loss not just being a health issue, but also being a demographic time bomb. But the great news is Europe is waking up to this and change is happening, and I wanted to share that story with you today. This is Brussels, home to waffles, beer, politics, and today, in my opinion, one of the most important conversations happening in global healthcare. This meeting in European Parliament, solely focused on hearing care, was hosted by Hungarian medic and MEP András Kulja and EHIMA, the European Hearing Instrument Manufacturers Association. Now you might think, hearing loss, isn't that just something that happens with aging and is inevitable? Well, today's conversation was all about why this statement is far from true. I'm going to tell you something interesting now. I mean, I say that, I think all the things I say are interesting, but the global figures on hearing loss are absolutely staggering, especially when you consider that for the majority of people that develop a hearing loss, it is preventable. Now, I know that's a controversial statement to make, but you did hear me correctly. An age-related hearing loss, in my opinion, isn't technically age-related. It's wear and tear related. And if we were to care for our ears more, we would limit that wear and tear and reduce the chances of an acquired hearing loss, plus everything that comes along with it, which I'm going to cover shortly. Now, this isn't entirely brand new information. However, it becomes incredibly hard-hitting when we have the likes of both András Kulja, MEP, Dr. Stefan Zimmer, Secretary General of the European Hearing Instrument Manufacturers Association, and then Arndt Kadolski, who is the President of EHIMA and the CEO of Sonova, taking to the floor to explain the sheer scale of this issue. Their message was backed up with data from the World Health Organization figures, stating that over 430 million people globally have some form of disabling hearing loss. And in Europe alone, it affects nearly 200 million people in their day-to-day lives. So what are the consequences of this for people like you and me? Believe it or not, if you're one of those 430 million people with an unmanaged hearing loss, there is an increased risk of depression and cognitive decline. There's an increased chance that you'll experience social isolation and depression, and there's an increased risk of a reduction in productivity. Now, I'm not saying this to get you guys down. You know me, I am always full of beans. But what I am here for is to help to try and kickstart this movement, as with this information alone, you would think that politicians would be keen on looking into the matter. However, in my opinion, if you want to speak the same language as politicians, you have to speak in their language, which is money. And so what is the effect of hearing loss on the economy? Honestly, it is unbelievable, adding up to a staggering 55 billion economic hit every year, which my good friend Google tells me is over 13,000 suitcases filled with cash, or roughly the same GDP as Luxembourg. Luxembourg. And then next up at this event we heard from Veronique. She's not a politician nor a scientist. She's a mum, a hearing aid user, and a powerful frontline voice in the fight against stigma. Genuinely, there wasn't a dry eye in the house when she shared her emotional story on how, as a child, she was bullied and incredibly shy as a result of her hearing loss. But then she went on to state how hearing aids and the support from her audiologists changed her world, and how she now lives in a world where hearing aids are normal and there is no stigma whatsoever. With her saying, and I quote, "My daughter tries them on and she says, 'Mummy, mummy, these are funny.'" That moment hit me. Hearing care isn't solely about hearing aids. Yes, that is one piece of the jigsaw puzzle, but it's about dignity, connection, and identity. Interwoven within the discussions, there were more numbers that didn't just shock me, but they left an entire room full of 40 people in complete silence. Dr. Stefan Zimmer dropped this statistic. 49% of people prescribing hearing aids never actually wear them. Why? Well, it's all about stigma, cost, denial, and awareness. And in reality, what are the consequences of this? Well, lost jobs, increased risk of falls, faster cognitive decline, depression, and, like I mentioned earlier, social isolation. When we know this information and we're not working together to do anything about it, this isn't just an individual problem or an individual's problem, honestly, it is a public health crisis. In my opinion, if some of the greatest leaders in the world have gotten together and decided to make sure that the lids on plastic bottles stay attached, then I'm going to make damn sure that I join this mission to ensure that the same people in power do something to tackle the issues around hearing loss. Now, on a day-to-day basis in clinic, I am so incredibly cautious when discussing cognitive decline and hearing loss with my patients. In fact, if I'm completely honest, I very rarely do. Now, you may argue that it's my duty as a healthcare provider to make anybody that walks through my door fully aware of the comorbidities associated with an unmanaged hearing loss. But there's something around the subject that actually, if I'm honest, makes me feel uncomfortable bringing it up. And I personally feel that the benefits of hearing aids on communication alone are enough of a reason for those that come through my door with any degree of hearing loss to commit to wearing hearing aids. In truth, there's now a proven link with neuroscientist Marlene Sopel telling it straight, stating that according to the latest research, untreated hearing loss is the #1 modifiable risk factor for dementia, with the latest studies showing that hearing aids can indeed slow cognitive decline. Not cure hearing loss, but slow it down, which means that every year that you delay wearing hearing aids actually matters. Later on in the day, I took to the stand too. All right, that sounds way more grand than the reality of what really happened. So let me rephrase that. I raised my hand to ask a question and discuss the elephant in the room, which hadn't been spoken about in all of the time that we'd been together. Over-the-counter hearing aids. My question was that OTC hearing aids seem like the perfect solution for everything that we've been discussing this day, as they should, in my opinion, help with price issues, stigma problems, accessibility issues. However, they haven't proven to scratch the surface in the US, and I wanted to know what the experts thought on why they weren't working. After a little bit of a silence, Marlene Sopel cleared her throat and said what we all know to be true. Accessibility and cost is important, but most people that we care for still need support. It's not just about affordability, it's about guidance, fitting, follow-up, and ongoing care. That was another thing that stuck with me from this event. Technology alone can't and won't fix stigma, but culture can. Brussels, you were great, and if there's one thing that I took away from my experience, it's that untreated hearing loss is certainly not inevitable. And it's definitely not harmless. It's also not invisible anymore. This is Europe's moment to lead, but awareness has to start with key opinion leaders, audiologists, and any of you watching that want to see change. I would absolutely love to know what you think is the solution to this, so drop me a note in the comments beneath this video. And when you're done, I think you'll love this video too, covering the best hearing aids of 2025.